Well, hello, everybody. My name is Ryan Huff. I'm the CU Denver Campus Communications Director. I want to thank you for joining us today. Hope everybody had an enjoyable winter break and welcome back for the spring semester. Unfortunately, COVID did not take a break and the case counts continue to rise here in Colorado and elsewhere. So that's why we're here meeting today. We'll be joined today by a panel of campus leaders to talk about remote learning, hybrid working, how best we can use technology for work and academics, especially during the month of January, how we're keeping our facilities clean, and also if you end up getting COVID, what the reporting process is. So throughout the next hour, if you have a question, please drop that into the Q&A function here at the lower right of your screen. And we will either answer that question live or with a written response in the chat. So this is your opportunity to get all your questions answered. And if we don't get to every question, I know we had a lot the last time we did this, we will certainly use that list to help inform FAQs that we put on the Lynx Together website. So first up, I would like to welcome Chancellor Michelle Marks, who will provide some opening words. Chancellor Marks.
Great. Hi, thank you so much, Ryan, and good morning, Lynx. I hope that everyone was able to rest and to recuperate over the holidays, and I hope that you continue to stay safe and healthy while we navigate not just COVID, but also the tragedy of the recent fires and other challenges. This sure hasn't been the way that we would have hoped to start 2022. Omicron has definitely taken center stage in Colorado and in the nation, and though we may be completely done with this virus, it is not yet done with us. I first and foremost want to say that I am forever grateful for the work of our Lynx Together Task Force and the COVID team and the leadership of our co-chairs, Chris Puckett and Dean Pam Jansma, who you'll be hearing from today, and for the work that all of you are doing, students, faculty, staff, across all areas of CU Denver, to ensure that we can keep our education going and to make sure that we can keep our community safe. This has always been our priority. We make every single decision with our students, with our safety, and with science at the forefront. And because of that, we have a track record that we all should be proud of. And at every step, we have relied on our experience and the latest public health data and our partnerships with the city of Denver and the state of Colorado and our own experts on our faculty and in the School of Public Health and elsewhere to make the best decision possible. And clearly, these are proving to be uncertain times. But I will say that after 2 years of operating through a pandemic, we are fundamentally in a different place than we were at the beginning, and we have a lot of experience to guide our decision making. So for the spring semester, we are requiring boosters by January 31st or 6 months from your vaccination. We're also starting virtual. We're doing virtual learning from January 18th to January 28th. And we are also encouraging supervisors to support remote work for staff where possible until January 31st. And we're taking these actions because the Colorado Omicron spike, as you know, is anticipated to happen in January. And this protects our community through this surge. Hospitals in Denver are close to full, and we have an obligation to our community as well as to our campus. And as we are all reading about other settings like K-12 and like healthcare and grocery stores, we too have concerns about staffing levels and about business continuity over the next few weeks. So we believe this approach gives us the best chance of having a very successful campus-based return on January 31st. So I want to be clear, we are back in person for work, studying, learning on January 31st. That doesn't mean that everybody has to be in person all the time, but it does mean that we all need to be prepared to provide in-person service to our constituencies at that time. I want to quickly remind people that boosters of Pfizer and Moderna vaccine are continue to be provided at the Auraria Health Center for all eligible individuals. And so please, if you haven't already made arrangements, get your booster shot. We have smart public health protocols in place to protect all of us. So let's please continue to work together to uphold them and to ensure our community's safety. And as we move forward this semester, my leadership team and I want to encourage all of us to continue to find more ways to work together on these critical issues. And we have created this new webinar series. We're part of it today. We're calling it Community Conversations. And the goal of these conversations is just that, to have real conversations, meaningful dialogue with your participation about how we're managing the challenges that we face, how we're continuing to realize progress across our university, and how we continue to support each other as we do our work. And you'll see more members of our Lynx family take part in them, and they'll be on topics of importance and interest, just like the conversation today. Before I turn it over to our co-chairs to talk us through the recent changes and our overall approach, I just want to say again how proud I am about the ways that all of you, students, faculty, staff, have adapted and responded. COVID continues to push every one of us to our limits. And that is why it's important that we continue to find ways to give each other grace and to take care of ourselves and our family. So let's be there for each other and for ourselves, as I know we're capable of, because that is what is most important. And now I'm going to officially turn the rest of this community conversation over to Chris and Pam and our team, who's going to be running the conversation from here. They're going to give you more details on operations and be available to answer your questions over the next hour. We have an incredible team of leaders and experts. Thank you all again for your dedication and your hard work and your care for our university and community. And I'm handing the baton now to Dean Pam Jansma. Thank you.
Good morning, everyone. Thank you, Chancellor Marks. Well, here we are again, I think is something that we can say. And I hope all of you had a wonderful break and are ready to tackle this new semester. As Chancellor Marks said, we are going to be virtual, remote for the first few weeks until January 31st as a result of the Omicron virus. I don't think this is a place that any of us really want it to be. And I think we all have a bit of anxiety and uncertainty in what is going to happen. Please know that we are working behind the scenes to make sure that we are making the best possible decisions we can make with the information that we have. I also know that all of you, faculty, students, and staff, have worked really hard over the past 2 years during this COVID pandemic, and we have adjusted. We have had our ups and downs. We have had a lot of uncertainty. I think that we can see the light at the end of the tunnel. And the reason we're doing this now is so that we can get back to more of a sense of normalcy, although I don't know what normal really means anymore. So I just wanted to say thank you to all of you for all your hard work and for hanging in there for a little bit longer while we try to beat this thing and get back to what we really want to do, which is to be together and see each other in person. And with that, I'm going to pass it over to Chris so that he can give us the latest updates.
Thanks, Pam. I've been noticing here in the Q&A, I want to acknowledge and recognize it looks like we have quite a few students with us today, and I want to thank you for joining us and welcome you to the Lynx community. For those of you who are brand new to CU Denver this semester, welcome. We're glad you're here. We're excited you're here. We know it's not the easiest of times or the best of times, but we are going to get through it. And we've done this for the last, unfortunately, the last 2 years. And we will be here, as Pam said, to support you. And we're here for your success. And so please know that as Chancellor Marks indicated at the beginning, we're making decisions based on what we believe the science is demonstrating and what the facts are. But we're also very much aware of and trying to make decisions that are in the best interests of our community and our students as a whole. One thing that I will start to talk a little bit about is, as Pam mentioned, we are all sick and tired of the world we're in at the moment. Those of us with kids, my wife and I joke about it, but we have a daily conversation about, okay, we made it another day. We made it another day. That's how we're seeming to live right now, which is, am I sick? Is my kid sick? Do we need to pull off one of the rapid tests off the fridge and get somebody tested? And for now, that's where we are. I think the hope is, and I think my belief is, we're not going to be there always. And we've already seen how that's happened in our communities. This isn't going to be forever. However, for now, it's going to be tough and it's not easy. I think one of the things that I continue to remember and recognize is that we're here in it together. And that one of the things the provost is going to be sending out later this week too is how do we care for each other in the midst of this difficult time? And I would also ask you to think about how do you care for yourself, your mental health, your well-being, and try to do things that are smart and good for you as we try and enter into this period of time. A number of people have asked, why did we make the decision we did? And the decision was made at the end of December, I should say last week, because looking at the data, looking at the trends, Chancellor Marks and senior leaders believed that we need to do our part to try and address COVID spread. And frankly, we all recognized that priority probably needs to be where priority needs to be, which is probably in our hospitals and in our K-12, meaning those are the things that we need to continue to have operate in an in-person basis. And so a lot of the reason we made the decision was because we recognize that we all as a community add to the impacts for both K-12 and for in our healthcare system. And so we do not want to be part of adding to that impact. And so that's why we are where we are. I think a number of folks I've already seen in the chat, people are asking, well, when are we going to make the next decision? When are we going to make the next decision? As Chancellor Marks said, we are asking everybody to be prepared to come back on January 31st. Now, what does that mean? Does that mean that everybody comes back? Does that mean that some people come back? What does that mean? Well, as Cade Ross, who's on the call as well from housing, indicated, we are continuing to keep our dorm open. We are continuing to expect and welcome students this weekend, the 14th, 15th, and 16th. We believe that we can continue to operate that safely and with success. And we believe that on January 31st, we will be able to open for in-person classes. Now, what I would tell you is that we're going to be watching very closely what happens over the next 2 weeks. And just as we have for the last 2 years, we're going to continue to watch that data. We're going to continue to watch what's happening around us. If things change, then we will pivot if we have to. But I think at this point, what we truly believe, and we've seen this over the last 2 years, is that spread doesn't happen in classrooms, that cases aren't spread through classroom contacts. Over the last 2 years, we've had a single outbreak involving a classroom, COVID being passed in a classroom, and that had to do with an anatomy lab where students were very close proximity, very close together for long and extended periods of time. We haven't seen anything else similar to that. And so what does that indicate? That we believe we can do classes carefully and in person. Now, I will just say this once again, if the next 2 weeks change and things get worse, then we will continue to, and Chancellor Marks and I literally on a hour by hour basis, if not more frequently, are in touch about what does the data show? What are we seeing? What's happening across the world and what's happening across the country and what's happening in the state and what's happening in Denver. So although we are absolutely hopeful, we also recognize that there are many things that are outside of our control at this moment. And so we are going to have to wait and see over the next 10 days or so how we move forward. So a couple things that I did want to make sure and highlight. As I indicated before, we know what works. What do we know that works? Vaccines keep people alive. They keep you from getting seriously ill. We know that masks work. We know that mask wearing is helpful. And we know that staying home when you're sick and recognizing your symptoms is effective. And those are the things we're going to continue to focus on. As Chancellor Marks indicated, we are requiring everyone to get a booster by January 31st. For new students who aren't familiar with our vaccine requirement, our vaccine requirement is that any student who's taking in-person classes must be vaccinated. And that now means 2 doses plus a booster, the 3rd dose. Because you are students, we actually have are able to access the statewide database of vaccines in Colorado. If you want to apply for an exemption, you're welcome to do so. You can go onto our website, the ucdenver.edu website with the COVID website, and apply for an exemption there. If you have questions about that, you can also email vaccineexemption@ucdenver.edu. For the rest of you who are eligible for and will be receiving a booster, our expectation is that you get the booster 1 month after you will be eligible. So currently, there's some discussion about whether it's 5 months after Pfizer or 6 months after Moderna or 2 months after Johnson & Johnson. Well, what our expectation is that you will get your vaccine 30 days after your booster, I should say, 30 days after you're eligible for it. Our plan is to track that information in the background, and about once a month or so, we plan to contact or reach out to the folks who are eligible that previous month, confirm who's already received it, and confirm those who have not. So that we'll continue to follow up on that. Just as we did last semester, those folks who are exempted or unvaccinated will be required to wear masks at all times on campus. There won't be any exceptions to that rule. They'll also be required to get a weekly test on campus. For those of you who haven't experienced it, we do have an online on-campus testing site. We actually have 2 locations. We have the 5th Street Garage, which operates at scale. And when it's fully staffed, which I just heard a few minutes ago that they're struggling with absenteeism as well on their staff. When they're fully staffed, they do 2,500 tests a day, and they can do up to 500 walk-ins. So what does that mean? So if you need a test, you can go to the 5th Street Garage, and usually early in the day, if it's a walk-in, they're limited on some of their tests, you can typically get in. Some questions have been asked. What kind of test is it? It's a PCR test, which is the gold standard. What's the turnaround time? Currently, our turnaround time all semester was about 34 hours. Over the last 2 weeks, our turnaround time was about 39 hours. So it's gone up a little bit, but it's still really, actually, frankly, just about the best you can get in Denver. We have another resource on campus as well for people who are symptomatic who need to get tested. We also have a booster shot clinic, and we have a clinic on campus, and that's the Auraria Health Center. And we'll make sure and get you the links to that. But you can contact them, and oftentimes you can schedule a same-day tests. They also have testing available. Their timeline is just about the same, but they're really focused on folks who are sick and really needing help or assistance. Meaning if you're immunocompromised or you have real concerns and you need to talk to a health provider, that's where they're best. If you just need a test, the 5th Street Garage is the place for you. In addition to those 2 testing locations, we are working with the state to receive additional tests, rapid tests. So the 14th, 15th, and 16th, which is this weekend, we will be doing rapid tests in the folks who move into the dorm. We've been able to receive those rapid tests from the state, so we'll be able to do those. It's a 15-minute rapid test. It's an antigen test, which is, there's a lot of questions about how Omicron impacts that, but what we do know is that for folks who are symptomatic and whatnot, antigen tests do work. That is what we have available at the moment, so we're going to continue to use those. And we probably are going to, we've actually made a request to the governor to receive more rapid tests. And so I anticipate that we'll be setting up a rapid testing opportunities later in the semester as well. If you haven't found it, the state, CDPHE, will send you 2 Binax, which has 4 tests total, 2 Binax testing kits, self-testing kits that are antigen testing kits. It is amazing. I have used that link probably 8 times since November. I have a pile of COVID tests sitting on top of my fridge. And every time my kid comes home with a snotty nose, every time I went to go see my mother, every time I go see my mother-in-law, I test just to make sure and to be careful. Does that mean I don't have COVID? No. But what it does do is it helps me get rid of some of my own anxiety, but it also gives some level of understanding of what is my status at the moment. So I can't help but encourage you to get those. I know the Biden administration is making some different things available nationwide. As soon as we get more information, we'll get that out to you. But what I can't tell you enough is rely on the state. The state's got it. They send them from Amazon. They show up at your house like 3 to 4 days later. It's terrific. Okay, I'm getting the message from Ryan Huff. We got 50 plus questions, which is going to make my head explode. But a couple more things that I want to just really quick, Ryan, really quick, go over. And maybe I can answer some of your questions. One thing that I want to make sure that we do, and this is one of the things we know works, if you're sick, don't come in. I know for the next through January 31st, we're going to do remote. If you can be remote, we're going to do it. But if you're sick, stay home. Contact your supervisor, contact your faculty member, talk to them, see what you can figure out. Faculty over the next 2 weeks in particular are going to be extremely flexible, hopefully, and that's the goal. And we have been for the last 2 years. And I think Pam can attest to this. We've seen this. Faculty have been very appropriate and very helpful for students who need assistance with flexibility. How you get into that pipeline, though, if you have COVID and you need to get an assistance, make sure you fill out your self-report form. Once you get into our self-report form, our contact tracing team can reach out to you and they can help support you with your faculty member. Our contact tracing team has been tremendous. Lacey, Quinn, Kimber, Sarah, many of you have been working with them, and they have been tremendous, and they can help support you through what you need to do. Make sure you fill out that self-report form. Another quick one. Got a question about who makes decisions about whether my class is going to be in person. Let's say it's an essential academic activity over the next 2 weeks. Let's say it's an in-person lab. We have asked the deans to work with the faculty and the chairs to identify those things that still need to happen in person over the next 2 weeks, just because of the way the semester works and that they're essential academic activities. Those decisions are made by the dean. They're not going to be made centrally. So continue to look towards your faculty member, your chair, and the dean. And we'll continue to move that forward. Ryan, if you want to join us back.
Yes, thank you very much, Chris. Well, we have about 60 plus questions here. So real quick, I just want to introduce our other panelists, and then we will jump right into these questions, and we'll try to provide quick answers so we can get to as many of these as possible. So in addition to Chris and Pam, I want to thank our other panelists for joining us. Greg Gibson is the Senior Director of Building Maintenance and Operations. Doug Cassian is the AVC for Employee Relations and Performance Management. Ted Geisler, an Assistant Director with OIT. Carrie John, Associate Vice Chancellor for Enrollment and Academic Services. Cade Ross, Executive Director of Housing and Dining, and Katie Linder, the Associate VC for Digital Strategy and Learning. So thank you all for joining us. Let's jump right into these questions. Most of them pertain around compliance with boosters, mask requirements and such. Let's just jump into the boosters one. Say I already got my booster 2 months ago. Is there anything new I need to do paperwork-wise to let the university know?
No. If you were in the state of Colorado, no. If you got your booster in the state of Colorado, you don't need to do anything else. If you did not get your booster in the state of Colorado, then what we'd ask you to do is go on to our vaccine verification form, fill that out, and then what it'll do is it'll have you ask you to upload a copy of your most recent vaccination, and that'll be your booster card, and you can do that in that space. So if you've done it in Colorado, we've got the information for you, both employees and students. But if you've got it elsewhere, then they go ahead and use that vaccine verification form, and that's where you can upload it. If you have questions about it, we are still using the vaccine exemption at ucdenver.edu email, and you can send something there. If you're having problems uploading, you can also send information there, and we'll get it taken care of.
Some people in our Q&A already have received the first 2 vaccinations. They've decided they don't want to get the booster at this time. Is the weekly testing option still available if they don't want to do the booster right now?
Absolutely. That is still an option. I think I saw a question about why should you trust me, saying that 2 boosters would work last year and now the 3rd booster would work. I would say don't trust me. I would say trust the CDC and trust the state. Both the CDC and the state are having active conversations about redefining what fully vaccinated means and including the booster in that. Because what this data is showing is that it is significantly more likely if you get the booster that you will have a much better outcome. It's not a guarantee that you won't get sick or get hospitalized, but the numbers are significantly in the corner of boosters keep you alive, they keep you from getting seriously ill, and they keep you from getting hospitalized. And so that's what we're relying on. So don't believe me, but let's believe the science.
In a scenario, so somebody goes to a testing clinic, they test positive for COVID. What are their next steps? Who do they need to inform at CU Denver?
Lacey, can you jump in on this one? Mute.
Hi, everyone. I'm Lacey. I'm the COVID case manager. If you guys are experiencing an exposure, symptoms, or you've tested positive, please go ahead and do the self-report form. The link is in the chat, and it's also on our website if you just search CU Denver self-report. You want to fill that information out, and our contact tracing team can help you work through any isolations or quarantines, or clear you to get back to work or campus. We are following the new CDC guidelines for isolation and quarantine. It's a 5-day isolation for anyone who's tested positive or is experiencing symptoms and have been exposed. And we will work with you on symptoms and improvement and get you back to campus when it's safe to do so.
Thank you. Let's talk about facilities. I want to bring in both Greg and Cade. Can you talk about what steps are being taken across campus as well as in the residence halls to keep those areas clean?
Absolutely. For the classroom and administrative spaces, we perform a triannual audit at the beginning of the spring semester, at the beginning of the summer semester, and again at the beginning of the fall semester to make sure that our building systems and components are operating in the most optimum manner possible. We've long since upgraded our filters and our mechanical systems to the highest level of MERV that we can handle with our systems, which is a hospital level filtration. So our caring and motivated staff stay on top of these things, and we monitor our building conditions through our building automation system. We also have custodial presence on campus for our 5 CU-owned facilities, where we, on a daily basis, address the common area spaces. This includes general wipe down, spill cleanup, vacuuming, entrances and exits, restrooms, circulation areas. An example of a circulation area, for instance, would be an elevator, a stairwell, or a corridor. Some of the common areas that we also address would be like the lounges and the seating areas. And we are fogging those weekly when the students are on campus. Additionally, for our CU facilities, we also address the high touch points. An example of a high touch point would be like a push plate or a door handle, push buttons like you see in the elevators, or any of the hard surface furnishings that people tend to slide their hands down. For classrooms and computer labs and instructional labs, excuse me, those are the primary responsibility for the individual users and occupants. However, facilities is happy to provide supplies if they need it in the classrooms or those labs. We'll put an email in the chat where you can reach out to if you need to have a restock of those supplies. And when classes and school is in session, we do the fogging of the classrooms daily, on a daily basis. For personal offices, we will address those upon request, but as a matter of routine course, we address reception areas, conference rooms, copy and mail rooms, kitchenettes, just as a matter of course, to just do our daily cleaning. Also, from the custodial perspective, we do a biannual cleaning of all of these spaces, like a one-time deep clean that happens at the beginning of the winter break semester and at the beginning of the summer break. And it's already been accomplished in advance of this semester.
Thank you, Greg. And Cade, similar protocols in the residence halls, and can you also talk about testing, vaccine requirements, et cetera, for the residence halls?
Absolutely. So similarly to what Greg was describing, we do regular cleanings of all common areas, stairwells, bathrooms within the residence halls. We've also increased our MERV rating on our filtration system. That was done almost 2 years ago at this point when Corona broke out. And so we continue to practice that within the residence halls. In terms of testing, we are requiring testing for students to return to the residence halls on a couple of different scenarios. So one is that a student can provide negative PCR test results from the last 72 hours. A new email will go out later today that also includes the ability to show that there's proof of testing within the last 72 hours, but still waiting on a result to come back. We know that testing is taking a while across the country, and so we're adjusting our process for that. In addition, we will be providing testing, the rapid test that Chris described when students arrive on a testing schedule that was emailed to students in December, and another reminder will go out today. But we'll be testing on Friday from 7:30 a.m. until 4 p.m., on Saturday from 10 a.m. to 4 p.m., and Sunday from 10 a.m. to 4 p.m. in both Lynx Crossing and City Heights. In addition, students who have tested positive within the last 90 days will be able to submit proof of a positive test to exempt themselves from that testing. But that information will go out to parents and students later this afternoon, just as soon as I draft the email.
Thank you. And just a reminder here, if you have questions, please put those in the Q&A. I know some people have placed them in the chat, but if you have questions, the lower right Q&A function, just so we have one stream of answers and questions there. We'll get back to some medical questions in a moment, but I just wanted to bring in Katie and Ted to talk about online learning, if faculty have questions on how to set that up, if students have questions, just resources available to them.
Absolutely. Thanks so much. We do have some wonderful folks who have stepped up to provide one-on-one support for faculty and instructors who are transitioning their courses into a remote environment and have some questions or just want a little bit more support. We can drop a link to that into the chat for people who want to sign up for that one-on-one support. And that's being provided through a collaboration with OIT, the Office of Digital Education, with our friends in the Center for Excellence in Teaching and Learning, and with several faculty colleagues who've donated their time. So if you go and sign up with that link, you'll see that there are several appointments available multiple times during the day, and even some evening appointments if you need that. And that's going to be our primary way of supporting faculty, just to make sure you have that just-in-time one-on-one support. And I'll go ahead and pass it over to Ted to address the student support as well.
Yeah, thanks, Katie. So all students and faculty can call the OIT service desk at any time, and that's kind of our central hub for triaging and connecting you with the appropriate resource. And so the service desk can be reached I'll put the number in the chat, but it's 303-724-HELP, which is 4357. And I will also drop the website URL into the chat, which is really helpful. And we have different teams at OIT that can offer one-on-one assistance. So especially if you're a faculty transitioning to remote, we have the academic technology group that can schedule one-to-one about how to make your class remote through Canvas. And then also I saw a question in there about using on-campus spaces and infrastructure to teach remotely. And so you could also leverage our AV classroom support team and do one-on-ones about what kind of cameras and microphones they could set you up with, teach you how to use if that's something you're interested in. So I will drop that information into the chat here momentarily.
Great, thank you, Ted and Katie. We can get back to some medical questions, Chris. I know you addressed this in some of your opening remarks, but we have several questions on how will we know if January 31st is the actual date we come back? Is there a chance it'll be extended? Is this whole semester going to be on Zoom, right? Questions like that. So maybe you can address that.
Those are great questions, and I wish I had all of the easy answers for you at the moment, and I don't. What I can tell you is this, is what we know, and I'll tell you, speak for my own kids. I know for my kids, they need to be in person. They're 10 and 12, and for them to get the social interaction and the engagement that they need to be in person a lot. So I know that in our students as well, we have seen and we experience that a lot of our students want to be in person and actually sometimes do better in person. Not always. There are many students who do really great online. So it's not an either or, but there are definitely folks who feel like they need to be in person. And frankly, as the provost often says, we want to try and be here for you. And that's the plan, is for our faculty and our staff to be able to be here for students in person. So what I would tell you is we are planning for the 31st. The numbers we continue to watch as far as the things that we get very concerned about are a couple. Hospitalizations, right? That is a huge one. What kind of pressure and impacts are we putting on our hospital care system? The other one, absenteeism. I think if we see significant portions of our community absent, then frankly, we're going to have a hard time functioning. And so in those circumstances, we would absolutely have to pivot. An example that has just come up more recently in the library, I know that a number of them, the folks in the library have been ill with COVID. And so we've had to modify their open hours. And, I think it's possible that could happen over the next 2 weeks, and we might have to pivot. So absolutely, we're not going to just go into this blindly and force everyone to come back. But at the same time, we're gonna have that as our goal at the moment.
Can you talk about masks as well? The CDC in the last few days has talked about KN95s and N95s. Will we require those?
We won't require them. We are going to be providing, so a couple thoughts. Surgical masks we're ordering crazily. Lisa Atencio, thank you. I know you're out there. Lacey, thank you for this. We are ordering surgical masks. Our goal is to have surgical masks available for anybody and everybody who wants them. Somebody asked if we'll have it at every door. I probably won't have it at every door, but we'll probably have it at every building that we operate. So you'll be able to use some surgical masks. The KN95s, we're in the process right now of increasing our supply of and finding a good supplier for. So I would say that if and when we do come back in person, and we're aiming for the 31st, we will have KN95s available. You may not be able to get one every day, every time you're on campus, meaning we're going to expect you to reuse them because we just aren't going to have enough for everybody to get a new one every day. But we will have KN95s, at least a limited supply. We're, like I say, we're trying to up to that. And if that changes over the next 2 weeks and we're not able to obtain what we need to, I'll let you know. But we aren't going to require necessarily right away that people get rid of their cloth masks. Now, obviously, there's some strong recommendations. Chancellor Marks even indicated to us this morning, she thought there was a CDC call this morning on this very topic. And so that may change, but at least what I would say right now, that's where we're at. I think one of the things that we continue to have, and Lacey's team has been doing this, we're going to have mask ambassadors, COVID ambassadors on campus. Part of their job, and you may have run into them last semester, is to continue and encourage folks to wear their masks, make sure we're doing what we need to be doing, and then rewarding people when they are doing what they need to be doing. So that's one of the questions we often get. And frankly, we actually see pretty good compliance with these folks. And we've got another crop of students who are absolutely willing to engage in that. And we're going to be paying them to continue to remind us all that we need to continue to wear masks, and that does protect everyone.
This question's come up a couple times here. What's being done to protect those who are immunocompromised, or are there any special considerations when we do go back to in-person if they want to stay remote, either as an employee or a student?
And Doug, Cassian, I think you're on here too as well. If someone has a specific request or need, how would you recommend they go about that, Doug?
Sorry, could you repeat that? I was typing an answer to a question.
Sure, no problem. We got a question about somebody who said, hey, I'm immunocompromised. I may have a specific circumstance that I need to talk with my bosses or people about. How do I go about that?
Sure. We have a process to request alternative work arrangements, and we can review that medical information there, or the ADA coordinator can also come into play, and we can have some discussions on that level as well.
And Doug, while we have you, for some of the questions we've received, January 31st, we're back in person as much as possible. How do departments and employees go about deciding, are we in person 5 days a week? Do we have a hybrid schedule? How do they go about making those decisions?
Well, I think they'd have to look at the manner in which remote work could work for that particular unit. And if there's any doubts, we're certainly glad to have discussions in our unit as well.
Thank you. Carrie John, wanted to ask you this one. Hope you know the answer to this. It's a question in the chat. How will you cater for international students who would not be able to have their visa before January 31st?
Well, thank you. Right now, it would be best to interact with our Office of International Affairs. The staff is ready and able to support any issues that students might be having with regard to coming back or getting back into the country. And that's the best option for support.
Thank you. Just scrolling through, so many questions. This is really great. We have so much participation, and we enjoy your questions. So please keep them coming here. So one question here, how are you addressing the many people who've decided that they're going to just travel more and extend their trips, staying outside of Denver? There are, say, students on winter break that they stay on break, and then they're flying back, before January 31st. Do we have concerns with travel, or what would we advise people to do if they're outside of Denver?
If they're traveling outside of Denver right now?
Yeah, just so, for example, if they're not in Denver and they are coming back a day or two before January 31st, do we advise tests, or what kind of
Yeah,
advice?
that's a really good question. Thanks, Ryan. We are not requiring tests necessarily for you to re-engage in our community before you come back. Having said that, we would absolutely encourage you to do that. For example, I'll just give you a quick example. Our on-site 5th Street Garage Clinic, 22 people, medical providers for the most part. They all showed up, I think it was a week ago Monday. None of them had any symptoms. They all got their antigen tests, meaning just the quick tests. 6 of them were positive and they had no idea, right? So I don't know that that's common. I don't know how widespread that is with Omicron right now, that we're seeing a lot of asymptomatic. I just don't frankly know. But what I can tell you is the more information you have, the better off you're going to be. And you're going to be able to offer those yourself and those around you with more confidence and more certainty if you are able to get tested and get something, get some level of a baseline of understanding of what your status is.
One of our audience members writes that about a week ago, Chancellor Marks announced that we are changing our definition of fully vaccinated to the initial dose or doses plus a booster. The CDC has not yet done that yet. So this person would like to know why we've made that decision on our own.
It's a good question. I think that what we saw, and I don't have the data in front of me, what we saw from the state's data, Rachel Hurley, who's the state's executive director for the medical response to COVID, provided some really compelling data that had to do with the impact and likelihood of the boosters keeping you alive, keeping you from getting sick, and keeping you from being hospitalized. And even with people receiving two doses, the third booster significantly, to the order of 3 to 4 times, made it 3 to 4 times less likely you were going to experience serious outcomes. So receiving the booster was 3 to 4 times, helped you 3 to 4 times less likely to be hospitalized. And that's a significant enough impact that leadership felt like that was the appropriate response at this time. And we continue to, and as well as Michelle Marks said, Chancellor Marks said, we continue to engage with our local and our state health officials, and that's absolutely something they support. And frankly, it's actually something that I anticipate seeing later this month, at least on the state level, that the booster will become part of the definition of fully vaccinated.
I want to send this next one to Cade. This is one that came in via email before our session today. What happens to students who test positive, and if they live in the dorms and they have 1 or 2 other roommates? What are the procedures in that case?
Absolutely. So my team works very closely with Lacey and Chris for the contact tracing team as well. So when those self-reports come in for housing students in either building, those go directly to myself and a few members of my staff. And so at that point, we move students either into isolation or quarantine, depending on the circumstances that they're in. So if they test positive, they're currently experiencing symptoms, any of those things, we will move them immediately into an isolation space somewhere for that 5-day isolation period. And then Lacey's team is the one that essentially releases them from isolation or quarantine, at which point they go back to their regular space. But at no point do we look to keep students who are actively positive or actively experiencing symptoms in their doubles or triples or suites.
All right. Thanks, Cade. Ted, you have some more information to share about some technology.
No, thanks. I just wanted to say I saw another message, and to be clear, I said that you did to call the service desk at any time, and I just wanted to make sure that everyone knew that our hours of operation are Monday through Friday from 7:30 to 5 in the morning to 5 p.m. And so if that doesn't work with your schedule, you can email us at any time, and that email address is front and center on the website that I posted in the chat. But I just wanted to be clear that about our hours if you wanted to give us a call.
All right. Thanks, Ted. Chris, I think this next one's for you. Can you explain how boosters work to protect the community and the individual boosted? So in other words, why should young, healthy people get boosted?
Well, at this point, what we know about COVID is there are a lot of young, healthy people who thought they could be young and healthy and they wouldn't get COVID and it wouldn't impact them. And so they didn't get any vaccinations, right? And what we know is that there were many people who still are, many people who are still impacted. They got seriously ill and many of them died. I would say that what we're learning about this COVID SARS-2 virus is that we don't know everything we should. And so the honest to God truth is, and I see a lot of questions, how should I know to trust you? How should I trust the CDC? That's a really good question that all of us have to address in our lives, is how do we go about making decisions in our lives, and what information do we rely on to make those decisions? Great questions. And there's, frankly, at a university campus, those are things we should talk about and engage with. And what I would tell you is this, is that we continue to see very few negative outcomes from a single shot, a second shot, or a booster of the mRNA vaccines and the others as well. There frankly are very, very, very few. I'm not saying they're not, but there are still some outcomes, but they're very few. And so when you consider across a population, especially as broad as ours, let's say 25,000 people, we recognize that across that many people, we can change the course of the pandemic in our community. And one of the ways we're trying to rely on that is relying on the data that's coming from the CDC, that's coming from CDPHE, that's demonstrating also, frankly, the WHO across the world. South Africa when it comes to Omicron, Denmark when it comes to Omicron, UK, London when it comes to Omicron. What are the trends that are happening there? And those trends continue to be that the booster provides, keeps people from getting seriously ill. And that's the data we continue to rely on. And that's why we continue to make those decisions.
Thanks, Chris. This next one could be for Pam and or Chris. Someone writes in, I have 3 students who are signed up with me for lab independent studies. Is it possible to schedule a 1-hour one-on-one meeting instructions with each one of them? I think that, let's assume that pertains to the month of January, and question for in-person meetings, any social distancing requirements and such.
Yes, I think that's possible. I mean, Chris, you can correct me if I'm wrong. We've said that as long as you follow all the protocols and do it safely, if it is something that you really need to do in person, we're not going to stop you from doing it in person. So I think that that's fine. Chris, do you have anything to add?
Sounds great.
Yeah, maybe just to follow up on that, either for Chris or Pam, say a faculty member has a lab or a studio. What guidance would you give them if they want to conduct that in person for the first 2 weeks of the semester?
I think pretty much what I just said is that if you really feel that it's essential to be in person and you cannot accomplish the learning objectives through remote, then you need to follow all the safety protocols that we've established in the past. Everyone has to wear masks and be socially distanced and so forth and so on, and everyone needs to be vaccinated.
All right, thank you. Chris, some people are already moving ahead to kind of the 4th shot. Will we at some point require the 2nd booster? I know you can get out your crystal ball here.
This is a marathon, not a sprint. And what I would tell you is I don't know. And we will have to wait and see. I know that for those of you who haven't seen it, Pfizer has suggested that they may have an Omicron specific booster shot available in March. Obviously, who knows whether that's going to be effective or impactful, and we'll have to all wait and see what that happens. I think what we have all learned is that, as I said before, we don't know everything about COVID. We don't know everything about COVID SARS-2. We don't know exactly how everything's going to turn out. And so I don't know exactly whether we will have a 4th booster. Is it possible? I'd say anything is possible at the moment. And I would say that I do think one of the conversations that we continue to have, and frankly, one of the reasons we're going to be bringing the band back together in the not too distant future with some of our teammates is how do we address and how do we move forward in, I hate to use the term, but it's the next normal of what does this look if it happens to be long-term, right? And how do we, what things need to change and what things do we need to consider differently? And so that's absolutely something we're going to be talking about as we move forward.
One of our audience members wants to know, and I think I know the answer to this, but any discussion on when the mask mandate might end on campus?
No. I would say this, there are definitely some things in my life that I'm going to wear masks probably the rest of my life. I probably am going to wear a mask every time I get on a plane the rest of my life. So I don't know. If you'd asked me that this summer, I would have hoped that by Christmas, we would have been in a place where we could have talked about it seriously. And that was the plan, frankly. That was the plan, was that we month by month, we're talking about it, and we were talking about it. But I don't know at this point, whether and when that is likely to change at this point.
Mark writes in just a question on keeping people honest. Why should we trust that the people who refuse to get vaccinated and boosted will comply with the testing requirements and, honestly report the results?
A great question. I think something that we saw in our community, and this is an approach, and I think I appreciate the provost for this, and Pam as well. We want to make policies about the 97, 98% of our population that is doing everything they can and is approaching this pandemic, trying to do everything they can to do what they need to do. And that includes folks who aren't vaccinated, who are exempt, because that's what we're seeing. We are seeing folks who are not vaccinated following the protocols. And is there 100% compliance? No. Are we having good compliance, significant compliance? Absolutely. And that helps protect all of us. And so our approach has been, let's take this from a positive standpoint and figure out a way to do that and support folks. How can we support folks who come forward and self-report? That's our goal. We don't want to make people go underground and say, I can't report, I can't do this. No, we want to work together and support each other through this. I think that one of the things, many of you don't know this, but at the end of the semester, or close to the end of the semester last year, we actually did have, and we turned off computer access for between 30 to 50 students because they weren't compliant. And it frankly ended up being a very, very small number. And Lacey was on there with me too. And why did we do that? Because we were serious about compliance. And guess what? We got people compliant pretty darn quick when they couldn't access things. Are we going to do something similar this semester? Absolutely, hopefully not. But if we have to, we will, because we recognize that it's important that we have policies and protocols that have some teeth.
I'm just going to throw out about 2 or 3 more questions and then send it back to Chris and Pam for some closing words. One question here, are there any plans to provide more support to departments or faculty in enforcing the mask requirements for the campus, or whose job is it to enforce the requirements?
That's a really great question. I think it's something we talked about, for 2 years, which is, it's all of our expectations. Our hope is that we all work together to remind each other to wear a mask, because we're doing it to support each other. We're doing it to keep each other safe. And I will tell you, I know there are spots on campus where, and I said this the last time we were here, if there are spots on campus, locations on campus that we're having problems, email Lacey, email myself, and we will have our mask and our COVID ambassadors show up in those spaces. And we did. And that's something we're going to continue to talk about. How do we do that more effectively? In fact, I was on a call just this morning with AHAC, CCD, and Metro, and Cynthia from the library, to her credit, brought up that we need to, as 4 institutions, do a better job of enforcing mask compliance, especially in their space. And frankly, that's something we're going to continue to talk about. So do we have any plans at the moment to help support departments? Not necessarily, but I think it's a great conversation topic and something that we're going to take forward.
One question / suggestion we have from one of our audience members, we are seeing people that are vaccinated and boosted getting COVID. So why not have all of us get tested weekly, not just the unvaccinated people?
It's a great question, and frankly, something we've considered and talked about. I think that part of it has to do with capacity. Right now, if anybody's tried to get a COVID test recently, they know how difficult it can be. So we do have some questions about, can we get all 14,000 people on our campus through every week? Theoretically, maybe. And I think, frankly, that may happen in the future. But what we do know about people who are vaccinated and boosted is they are much less likely to get seriously ill, much less likely to pass that along to other folks. And so that's why we try to use tests in a strategic way more effectively.
Well, we've answered 116 questions, so thanks to all of our panelists and our panelists behind the scenes answering those. We have just a couple minutes left, so Chris and Pam, I want to turn it over to you. Any closing words or advice you would have for students, faculty, and staff for kind of getting through the next month safely?
Thanks, Ryan. Wow, thank you everybody for all of those questions. I can't believe we got through so many so quickly. A testament to everybody who's on the call today. So once again, thank you for everything that you're doing. I'm talking to students, faculty, and staff, all of you. I think we just have to take it one day at a time, as Chris said earlier this hour, and think about what is in store when we finally at least get back to whatever our new normal is. I know that everyone's anxious. I'm anxious too. Who knows what's going to be happening in the next couple of weeks, but we've done this before. We've done it well. And I think that we can do it again. And we can realize too, that it's not the same as it was when we first did this almost 2 years ago. We know a lot more. We know how to handle this. And for everyone, please make sure you take care of yourselves and your families, and make sure you have some time to relax and to let go and to just be, because I think that's going to be important. We're all tired. We all want this to go away. And I think we all thought it was. And so that's going to change how we think about it. But hang in there. We'll get through this because we've done it before and we're a great community. So thank you, everyone.
I just echo that. Thank you, Pam. I think that was well said. And thank you all for your questions. And I thank you for your patience. And I thank you that you're here, because we all want to be here, and we want to be here in person sooner rather than later. And I do believe that we'll get there. We will get there. So thanks for your time.
Well, thank you to Chris and Pam and Chancellor Marks and all of our panelists. And thanks so much to all the students, faculty, and staff who tuned in today. We had about 400 of you, and you asked some great questions. Please remember that every Thursday in our CU Denver News, we have a Lynx Together section where we provide updates, and we actually have some today as well. So please continue to check that. And thanks a lot, and stay safe. Take care, everyone.